Hello, hi, Assalamualaikum, dan selamat sejahtera to all my beloved students. So let's not wasting our time. Let's continue our lesson with the 12.5 health issues related to the human nervous system. Okay, health issues related to the human nervous system. Okay, so let's take a look on the learning standards that you have to cover for today. Okay, pupils are able to communicate about the health issues related to the nervous system. Yeah, okay, we are going to discuss about the health issues related to the nervous system. And then number 2, describe the effects of drugs and alcohol abuse on human coordination and response. Okay, so that are referred to the two learning standards that you have to cover for today. Alright, so now we are going to discuss about the nervous system disease. Okay, about the nervous system disease. Okay, so we should thankful to God because we are normal. Yeah, we are normal. So there are certain people that have a nervous system disease. Yeah, nervous system disease. Okay, whereby the central nervous system of this person can be damaged or cannot function efficiently. Alright, okay, so let's take a look on the examples. Examples of the health issues that are related to the nervous system. Okay, so the first example of the nervous system disease is multiple sclerosis. Yeah, multiple sclerosis. Okay, it is a progressive disease as a result of an abnormality in the immune system. Yeah, abnormality in the immune system whereby the immune system attacks the myelin sheath, in the brain and also in the spinal cord. Okay, so what happened? It will cause the damage of the myelin sheath. The damaged myelin sheath will prevent the transmission of impulse from and to the brain. Okay, so do you still remember what is a myelin sheath? So myelin sheath is referred to the protector layer here. Yeah, it is a layer that protect the axon. Yeah, it will protect the axon here. So once the myelin sheath is damaged, so what happens? It will prevent the transmission of impulse from and to the brain. Okay, so that are referred to the multiple sclerosis. Okay, as you can see from the diagram here, this is referred to the damaged myelin sheath. Yeah, damaged myelin sheath because of the antibody. Yeah, antibody attack the myelin sheath in the brain. Yeah, from and to the brain. Okay, so next we go to the second disease. Okay, second disease is Lou Gehrig or amyotrophic lateral sclerosis. Yeah, ALS. Yeah, amyotrophic lateral sclerosis. Okay, so this disease is caused by the deterioration and death of motor neurons. Okay, so because of the damage of the motor neuron, okay, that control the movement of muscles, such as chewing, walking, and talking. Okay, so what happened to this person? It will disrupt the movement of the muscle in chewing, in walking, and in talking. Okay, so because of the death of the motor neuron. Okay, so this is referred to the ALS affected nerve cell and muscle. Okay, next we go to the third disease here, third human disease here, third nervous system disease. It is Alzheimer. Yeah, Alzheimer's disease. Okay, have you heard about the Alzheimer before this? Alright, so that is referred to the loss of ability. Yeah, the loss of the ability of a person to reason and to take care of himself. Yeah, okay, so that is referred to the Alzheimer. It is caused by the loss of ability to reasoning, to reason and to take care of oneself. Okay, the patient is usually confused, confused, forgetful, and disoriented even in a familiar place. If the deterioration of the brain continues, the patient will lose the ability to read, write, eat, walk, and talk. Okay, so that are referred to the Alzheimer. Alzheimer. So these are referred to the healthy brain. This is referred to the mild Alzheimer disease. Okay, this one for the severe one. Okay, we can see that deterioration of the brain. So when the brain is damaged, it will cause the damage of the nerve cell, right? So what happens when the nerve cell damage? It will cause the person uh, cannot reasoning, or cannot think, it will easily confused, easily forgetful, all right, it cannot take care of himself, right? Okay, so that is referred to the Alzheimer. Okay, next we go to the Parkinson. Yeah, Parkinson disease. Okay, Parkinson. So this is referred to the Parkinson peoples here. The shrinkage of the nervous system that cause tremors, in the limbs, jaw, foot, and face. The patient will also have difficulty maintaining body posture and balance. Okay, that is referred to the Parkinson, the shrinkage of the nervous system. So when the nervous system is shrink, what happens? It will cause the tremors. What is the tremors? Tremors getaran, dia akan menyebabkan anggota badan ini menjadi bergetar, bergetar, the vibration. Alright. Okay, so it will cause this patient cannot maintain his body posture and also the balance, right, of the body. Okay, that is referred to the Parkinson disease. Okay, next we go to the attention deficit hyperactivity disorder, ADHD. It causes someone to become hyperactive, unable to concentrate, and gets easily bored. Okay, that is referred to the attention deficit hyperactivity disorder. This person become hyperactive, unable to concentrate, and gets easily bored. Okay, so what happened here? Okay, let's take a look on the brain with the ADHD here. Smaller brain volume, smaller cerebral hemisphere, okay, and loss of the cerebral cortex here. Alright, okay, that is the ADHD. Okay, now we go to the autism. Right, autism. So a type of disease related to the development of nerves in the brain. Relate to the development of nerves in the brain. Autism causes an individual to experience problems in communicating and interacting. Alright, okay, because of the development of the nerve in the brain. So this is referred to the brain of the children with the autism. Brain. So this is referred to the communicating, the nerve communicating in the brain. Okay, so this is referred to the typically developing children. So this one for the normal children. Okay, so the autism individual, will have a problem in communicate. It cannot talk. It cannot talk. It cannot think. Right? It cannot think normally. Cannot talk normally. It cannot interact with the other people. Right? Okay, because of the development of the nerve in the brain. Okay, next we go to the epilepsy. Okay, epilepsy, the occurrence of the abnormal activities in certain parts of the brain, causing the nerve cell to produce unusual signals. Occurrence of abnormal activities of certain parts of the brain. Okay, what happened? It will cause the nerve cell to produce unusual signals. Okay, a person suffering from epilepsy may become unconscious and experience muscle spasm or muscle cramp. Okay, so that is referred to the epilepsy. The person experience muscle cramp, because of the abnormal activity of the certain parts of the of the brain. Okay, so this is referred to the epilepsy. Yeah. Okay, next we go to the brain paralysis. Okay, brain paralysis. Yeah, so occurs because of brain damage before or after a baby is born. Yeah, before or after a baby is born, it possibly occur in children between the age of 3 to 5 years old. So this disease causes the failure in muscles and the ability of motor neurons to function properly. Alright, okay, that are referred to the brain paralysis, yeah, whereby the muscle cells cannot function. Yeah, the muscle cell cannot function, and also the motor neurons, they cannot function properly. So this is referred to the children with the brain paralysis. Okay, I think that's all. Yeah, okay. Okay, next we go to the effects of drugs and alcohol abuse on human coordination and response. Okay, the effects of drugs and alcohol, yeah, abuse. Okay, so these are referred to the substance. Okay, substance. Okay, substance involved here are drugs and also are alcohol. Okay, we go to the effects of this substance. Okay, first one, stimulant drugs. Okay, stimulant drugs. So the name of the stimulant. Yeah, this drug will stimulate. Yeah, it will stimulate. Okay, so what is the effect of the stimulant drug? Okay, first, increase the activity of the central nervous system. Increase the activity of the brain and also the spinal cord. Okay, and then excessive use causes temporary euphoria, which is followed by depression. Okay, so please find out what is a euphoria. Yeah, okay, so what is a euphoria? Okay, so euphoria refer to a feeling, yeah, refer to a feeling or the state of the intense happiness. So very happy. So this person feel very happy, yeah, very excited, okay, and then after that it will followed by the depression. Okay, that is referred to the excessive use of the stimulant drugs. Okay. Next, we go to sedative. Yes, sedative drug. Sedative drug refer to the depressant. Yeah, depressant. Okay. So, what is the effect? Delay the transmission of nerve impulse. Yeah, it will delay the transmission of the nerve impulse, and will calms the mind. Yeah, will calms the mind. Okay, we go to the hallucinogen drugs. Yeah, hallucinogen. The keyword here is hallucinate. Ya, hallucinate. Dalam bahasa Melayu adalah halusinasi. Okay, so causes the user to hallucinate. Yeah, to hallucinate. So what is a hallucinate? It is referred to the state of the person. It's like the person sees something. Yeah, it can see the something, but actually it's not there. Yeah, it is a hallucinate. Okay, and then it will relieve from pain and anxiety. Yeah, anxiety. Okay, relief from pain and anxiety. Okay, that is referred to the hallucinogen drugs. It will cause the user to hallucinate. Okay, next we go to the narcotic drugs. Okay, narcotic drugs. So it will delay the normal function of the brain. Okay, delay the normal functions of the brain. Okay, next we go to the alcohol. Yeah, alcohol will disrupt the coordination and thinking. Yeah, will disrupt the coordination and thinking, and it will delay the transfer of the nerve impulse. Okay, so that's why when we look at on the alcohol, yeah, alcohol drinking people or alcohol abuser, we can see this person always or after taking, yeah, after taking the alcohol, so this person drunk, yeah, drunk, and then it do not aware of the everything that occur in the surrounding, right? So that are refer to the effects of drugs and alcohol abuse, yeah, on the human coordination and response. Okay, so I think that's all in the 12.5 health issues related to the human nervous system. Okay, so I hope you can at least remember two or three examples of the nervous system disease. All right, and also the effects of the drugs and alcohol abuse, yeah, for in the human coordination and response. Okay, so that's all for now. Okay, stay safe, everyone. Take care.